syndromic surveillance practice, and electronic data exchange with electronic health records. So I really mentioned, sort of left off with pilot projects. As I said, we were also recommending that projects be undertaken that actually use inpatient ambulatory care EHR data for public health syndromic surveillance and response. And that was actually some of the rationale for including maybe some of the data elements that public health were listed as core optional, where public health may not have a lot of experience at this point, but anticipate significant utility out of those. Specific new areas to include were new public health uses for syndromic surveillance, such as chronic disease, injury surveillance, and then also benchmarking the value of these data sources, really looking at comparing, doing a gap analysis and comparing the performance with maybe other surveillance systems that are currently underway. And also developing, implementing, and evaluating the pilots, addressing data validity, sensitivity, and specificity of analytical techniques, timeliness of existing systems with the timeliness of new systems and new data exchanges, taking a look at a cost-benefit analysis, and then also making sure that we're identifying, defining, and sharing outcomes, the opportunities, and also associated barriers. So we really felt that the outcomes of these efforts would really be needed to further the practice of syndromic surveillance and refine the meaningfully used syndromic surveillance objectives in the future. So with that ends the more formal process